Hello, and welcome back to another episode of the My Dog Made Me Do It Naturally podcast. Today's guest is Dr. Josie. Is it Beug, actually? I didn't even check how to say your surname.
It's Beug. In German, it's Beug, but in American, it's
Okay.
Beug. So there you go.
It's a good job I said it right.
Yeah.
Oh, well, welcome, Dr. Josie. It's such a pleasure to have you on the podcast. I know we've had this episode in the pipeline for a while now, so it's great to finally actually have you here. And thank you so much for committing your time to me today.
Yeah, you're welcome. You're welcome. I'm happy to be here. So talk
Yeah.
and start the conversations.
Yeah. Okay,
Yeah.
so I mean, today we are going to talk about Librella, which is the main topic. I can't wait to dive into that. But first, I just wondered if you want to share a little bit of your story with us, because I do know that you actually did intentionally set out to be a holistic and integrative veterinarian, didn't you, from the beginning?
Yeah, I did. I don't want to go so far back. When I initially was going to go to medical school and I didn't I got into college pre-med and was completely disillusioned because all they were trying to do was weed out people from like freshman year of college. And I said, this is insane. And if I'm going to go to college and spend a lot of money, I want to spend it on something that I'm really passionate about. So I took a year off and really did some soul searching. And I was like, the one thing I could deal with talking about, learning about, doing every day if I had to get up in the morning every single day and go do something is to take care of animals or learn about animals or study animals or watch animals or, do something around that. So I ended up I got my biology degree. When I got out of school, I ended up working for animal shelters and I did that for about 5 years. And I was working, that has its own, the burnout rate is high to say the least. So then I went from that to working at a veterinary clinic and I found this vet was throwing away a box of books, and I'm not the type of person that likes to throw away books at all. And so I dug through the books and I found Richard Pitcairn's what is it called? Natural Healing for Dogs and Cats. And this was
Yeah.
the initial first edition. And I took it home and I had already been diving into herbal medicine. I'd been making my own herbal formulas. I grew up, my two older sisters were the kind of from the hippie generation. So I grew up with a lot of that. And I saw in the front of the book that vets were actually using herbal medicine and using chiropractic and using acupuncture to treat animals. So I called up the American Holistic Veterinary Medical Association literally on the phone. So we didn't have internet in those days. And I said, this is what I want to do. This is what I want to do for the rest of my life. And she's like, okay, dear, just calm down. But first you have to go to veterinary school. And that's like, I was like, had the steel gate thrown down in front of me, like, oh my God, veterinary school. So I did. I ended up figuring out that I had almost all the prerequisites for vet school. I applied for veterinary school in Wisconsin. I got in, but in my mind, I was going to go through vet school, get that degree over with, and then I was going to go on to study traditional Chinese medicine and chiropractic and nutrition and all the fun stuff. So when I walked in the very first day of vet school, they were handing out bags of Hill's Science Diet for free to all the students. And there was a big long line of the
Wow.
brand new students, the brand new class coming in. And I was the only student that didn't accept that free bag of Hill's Science Diet. And they kind of looked at me like I was crazy. And I said, no, I was feeding my cats raw at the time and making
Yeah.
my own cat food from Dr. Pitcairn's book, and his
Yeah.
recipes. So then I went into the school and they had all the school clubs set up in this area so we could walk around as like an orientation. And there was a Doberman laying there with acupuncture needles. And a third year vet student, it was his dog, and he was treating her with acupuncture. And it was like I walked up a staircase and he was there with the dog as soon as I walked into vet school. So I'm like, okay, good. I found the right place. So when I was there, I was president of our Holistic Veterinary Medical Association for 3 years. I brought in
Wow.
holistic vets to the vet school primarily because I wanted to learn from them. So I kind of co-designed a whole second track of learning. So I brought in a lot
Wow.
of the founders from the United States. And then I even organized organized the Midwest Annual Holistic Veterinary Conference 3 years in a row while I was in
Wow.
vet school. So, but then I also had to keep I had to do really good in vet school because they were like, these are Wisconsin farm boys. They hadn't heard of homeopathy or anything. And the faculty, I had to keep my reputation up with them as well because I was like the weirdo in the vet school. So yeah, so I got out and it was pretty interesting. I mean, in my nutrition class, my favorite story is my nutrition class because it was taught by the Hills Science Diet representative. And we went
Oh,
in, it was only like, it was maybe 6 weeks long for dogs and cats. We had to learn nutrition was one semester from like September to December, and it was every single animal. So we had to learn about cow nutrition, horse nutrition, feeding chickens, feeding pigs, feeding dogs, feeding cats, feeding exotics, feeding birds, all packed into like 4 months, which is a joke in and of itself. So the
yeah.
small animal one was maybe about 4 weeks, taught by Hill's Science Diet rep. And we walked into this laboratory and he had all these jars on the lab counters and they were filled with like crumbs of Oreo cookies and hard candies and like rice hulls and all this just garbage that looked like it had been swept up off the floor, literally. And they were like, well, this is a source of protein. This is a source of carbohydrates to go into the pet food.
Uh,
And all of my other colleagues, all the students in my class, they were just like, "Okay, okay," didn't question it. And we sat down and he started talking about protein, and I raised my hand and I said, "Well, what about the quality of protein versus the quantity of protein? If you're getting protein from dead, dying, diseased, debilitated animals, isn't that affecting the quality of the food that these animals are eating?" And he didn't have an answer. He started blowing smoke out his ears and I kept
oh,
pushing him. And then I finally had to stop because the professor was getting so angry that I'm like, oh man, I'm going to get kicked. It was third year, 3 years into veterinary school. And I'm like, I'm going to get kicked out the door if I just don't, stop right there. But so that was my vet school experience. So I take a little bit different of a path than a lot of people. I'm going to let my golden doodle got locked outside. So I've got to let him in.
oh, okay,
Yeah,
that's fine.
so I got my acupuncture certification and pretty much as soon as I could, I started my own practice because I just couldn't. I was working for other vets and I would be in one exam room and they would be in the exam room next to me and they would be telling clients the exact opposite of what I was telling clients. So I'm like, this is
Gosh.
not going to work very well for very long.
Yeah,
So
yeah.
yeah,
That's amazing.
so
I
yeah.
think it's such an inspirational story though, because I mean, even in the
Hmm.
what is it called now? The small animal clinical nutrition book that the vets use for
Hmm.
like nutritional assistance that has like lists of the hills food in there as well, doesn't it? For, if this
Hmm.
is a problem, this is the food that you can
I haven't
prescribe.
I haven't opened that book since that nutrition class in veterinary school, to tell you the truth. I don't even think
No, and
I
I love
ever
that.
opened that book, actually.
That's
Yeah.
amazing. That is amazing.
So,
No, the thing
yeah,
is though, like it's still the same
yeah,
old story, isn't it? It's the same old story now. Like this is
yes.
what they're being taught and stuff, which in a way, I mean, we're laughing, but it is a very sad situation in reality. Um,
Yeah. And I think it's almost gotten worse because I see
yeah,
vets coming out of school now and they're thinking less and there's less critical thinking and more of if you see this case, this is how you treat it. If you see this case, this is how you treat it. Instead of being able to critically reason their way through cases and
yeah,
use science and stuff. I hate to say it, I feel like science has it's very hard to find actual real good science anymore.
yeah, absolutely,
Pretty sad.
absolutely. And I think, well, I mean, obviously, I've never been to vet school, so I don't know from personal experience, but Um, from what I have heard from other places, I think they do spend less time on nutrition now as well. And apparently there is
Probably.
there is less actual kind of like instruction on how to do things such as like surgeries and stuff, and less practice in vet school, and it's more like studying and then kind of just being thrown into it and kind of learning on the job type thing. I don't know if that is true, but that is another thing that I've heard from people talking about their experiences at vet school.
Yeah, I feel like it's gone that route because now a lot of general practitioners coming out, like they don't know. I had a client who had a 6-month-old poodle who had a abscess on his neck because he'd been out running around through the woods and probably got poked by something and got a bacterial
Oof.
infection under his skin. And he was up
Yeah.
in New York, and he called me on the phone from the first veterinary clinic, from the exam room with the veterinarian standing right in front of him, and they couldn't figure out what to do with this abscess. She said, "Well, we stuck a needle in it and I pulled out pus." And I said, "Okay, great. That means there's an abscess there." And she's like, and I said, "Can you send it out for culture and sensitivity?" "Oh, our clinic doesn't have access to lab facilities." And this is a
What?
Blue Pearl corporate clinic. And I'm like, "What do you mean you can't send it off for culture and sensitivity?" And I mean, can you sedate him, lance it, flush it, put a drain in, like do what we do with abscesses? No, we're not able to do that because there's no surgeons in today. So then he
What?
then he drove to a second clinic. And that clinic, he put me on the speakerphone with that veterinarian. This is just 2 weeks ago. And the veterinarian was like, "Well, hello, Dr. Beug. We're sitting here trying to decide whether we need to call in the medical team or the surgical team." And I said, "Well, who are you? Aren't you a veterinarian, a doctor?" And she's like, we laugh, but it's really not funny because
No,
again,
it's not.
she was like, "Well, we could put him on antibiotics, but he's already on antibiotics from the other clinic, or the surgeon could come in, but they're going to want to do a full CT scan before they touch the dog." And I said, "It's an abscess filled with pus. Can't you lance it, flush it out, put a drain in it, culture, and put the dog on some antibiotics?" "Oh, well, we don't use drains in abscesses anymore." And so she called me antiquated because and so my client at that point, because he couldn't, nobody was going to even come into that clinic to see the dog till the next day. He's like, "Josie, I'm just going to get on a plane. I'm going to fly back to Miami where you're at and where my other vet is at, and we'll deal with the issue when I get back into town." So he got on an airplane that night and flew back down here. But by this time, the abscess has grown so full of pus, it was extending all the way out to this poor dog's chin, like the whole. So they went over to the specialty clinic to have a board certified surgeon deal with the abscess, and the board certified surgeon lanced it, flushed it, put a drain in it, and cultured it, and sent the dog home on antibiotics, which is exactly what I kept asking. Can't anybody do
Oh,
this for this dog?
wow.
So
So
that's
yeah,
kind of
so
the state we're at, which it's not good. I mean, it's
no.
especially not good for these animals. And so also, I mean, this can lead into the whole Labrella issue, is that they're not being taught basic practice skills. And then
Yeah.
along comes, pharma, who has made big investments in veterinary schools, and
Mhm.
they can come along with a product and and the marketing on this product was very interesting because about 2 years before they came out with it, they started a whole campaign against nonsteroidal anti-inflammatory drugs. Now, the mainstay in conventional treatment of arthritis for dogs is nonsteroidal anti-inflammatory drugs like Rimadyl, Carprofen, Metacam. We've used those. I have used those for 25 years. Yes, some dogs have problems with them. The majority of dogs do not. They keeps them up and walking. It takes care of the pain. They started a campaign on how it was going to kill their kidneys and liver and do all this damage. And oh my goodness, we can't use them and they're horrible. And then they turn around and say, "But guess what? We can't use those drugs anymore, but we've got this miraculous answer for you. And it has no side effects. And look, we can take a dog that can't walk and give it an injection, and it's up and running around like a puppy." So this is, but when I saw, you even see the television ads are horrible, and they have this little song, Labrella, like, so it's all marketing and brainwashing. And yet the vets don't
Absolutely.
know enough science to say, I read I a younger vet who I kind of mentor called me up and she said, "Hey Josie, have you heard about Librella?" And I'm like, "No, what's Librella?" She told me what it was, and I said, "Well, how long are dogs supposed to be on it if it's a once a month injection for arthritis?" "For life." And I'm like, "For life, and there's no side effects, huh? No, this doesn't add up." Right then and there, that does not add up. So I pulled the FDA package insert and there's a FOIA request. You can go on any, and this is really important for people to know. You can go on any product website. You have to hunt for it, but you can
Yeah.
find what the paperwork and the application to the FDA that they submitted and the FDA's response and everything. You can find all that paperwork, and that's really valuable information. So I pulled it up and I started reading through it, and immediately I was like, I'm going to be sitting here for a few days on this one. I just took the whole entire weekend and dove into it. And I started with every single line of that paperwork. I wrote up, and you can find this on my Substack page, wrote up why this was a giant red flag, a cover CYA legal language to cover themselves legally because they really
Yeah.
had no idea what this stuff was going to do in these dogs, essentially, if in plain English. So, they had things like, no, we're giving it's for dogs with arthritis, which is just a subset of senior geriatric animals. These aren't young animals. Now, most of senior geriatric animals have other comorbidities. So they can have heart disease, they can have seizure problems, they can have digestive issues, especially if they've on commercial food. So they didn't, and most of them have been vaccinated year after year after year. In the paperwork for the Labrella, they plainly stated, we do not know what this will do in a dog that has concurrent heart disease. We do not know what effect this will have in a dog that has been vaccinated before. You can find
Wow.
this on my Substack. I copied and pasted the exact legal language they used. And then you look at the studies they did, and it was the first study, I think it was 300, or no, it wasn't even that. I think it was 100. There was total in all of them was 300 dogs, but they took 100 young, healthy beagles and that had never been vaccinated, that had grown up in a laboratory setting, and injected them once a month for 3 months with Librella, and then
Three
said, "Oh,
months
look, no side effects." 3 months on a product that you're going to use for the lifetime of a dog, however many years the dog has left to live. And
on
then they
all of the
did the
different breeds
field
with all of the
study
different
where,
health conditions and.
yeah, yeah, we know nothing. So it told us absolutely nothing about that product. And then they said, they claimed, people really need to know this too, because there's all this new genetic technology that's being released that in my mind is actually there should be a moratorium put on it because it's placing all of us in danger. It's
Mm.
placing the entire human race in danger because they're messing around with releasing man-made genetic material that we have no idea how that is going to interact with our nuclear DNA, with the nuclear DNA of the dogs or anything else. So this is a man-made monoclonal antibody, which antibody is actually a pretty large protein molecule. And they engineered it in the lab to go in and bind to something that the mammalian body makes called nerve growth factor, which is another protein molecule. They just discovered nerve growth factor in the 1950s, and we still don't fully understand exactly what nerve growth factor does in the body or how it works. We know it helps repair and maintain the nervous system. That's a pretty big job to
Yeah.
repair and maintain the brain and the peripheral nerves and the nerves that go to our heart and our lungs and our organs, both the motor neurons, the sympathetic nervous system, the parasympathetic nervous system, the vagus nerve. I mean,
Mm.
and we're going to mess with something we don't really fully understand. We're going to inject them with something that blocks that entirely. anywhere in the body that if they find it, and then we're going to see what happens. So they actually did it. They started out with human clinical trials, and Pfizer and I think it was Eli Lilly got to stage 3 clinical trials where they were using it on humans with arthritis. They stopped the clinical trials. There's a board of rheumatoid arthrology doctors on the FDA, and they stepped in and they said, well, you have to stop the clinical trials because they were seeing, they coined the term for it called ROPA. They never had this
Yeah.
term before these clinical trials. And they
Yeah.
coined it as rapid onset progressive arthritis, where the joints start deteriorating in real time and start dissolving like sandcastles, just like sandcastles wisping away. So they had to take people from that study in for emergency joint replacement surgeries
Wow.
because it was destroying their joints. So they
Wow.
stopped the study. Yeah, which is kind of a nightmare. I mean, it's like a Frankenstein. It's like Frankenstein. So they stopped the trials, but then they had all this research and development invested in this product. So what do? Pfizer had split off their veterinary products into a separate company. Okay, so it's like a trick these corporations do.
Yeah.
That's not us, that's Zoetis. So they can take these drugs that are like almost like killing people and doing severe damage, and they throw it over, oh, let's give it to Zoetis. We can use it in dogs and make our money back on our research and development. And they're dogs. They're not gonna, they can't
People aren't
tell
going to
us anything. They
question it.
can't
They
stand
can't.
up and
Yeah.
complain. They can't say no, don't inject. Yeah, they're like, no, don't inject me with that. And plus they're old dogs which have arthritis anyways. So if we can make a few of them a little bit happier and walk for a while, then we'll do that and make our money. They actually
Yeah.
made,
It'll look
God,
good
what
enough
was
to
it? It
actually
was like
sell to
123
people.
million in the first year.
What? Wow.
Yeah. And
Because there's that many dogs with
so
arthritis.
yeah, but here's the other thing. Well, the arthritis is coming from the food. We know that.
Yeah.
The kibble, the pro-inflammatory, crappy food, and the seed oils. I went off seed oils myself, and my God, what a difference it's made in my health. So, anyways, they give it to the dogs, but then veterinarians, they were telling they flat out, they have vets that go into vet clinics and follow veterinarians around for 3 to 4 hours a day and say, oh, this would be a good case to try Librella on. This is how they sell it to them. So they had some vets, heard of some vets, if a 2-year-old dog came in limping, oh, give it a shot of Labrella because they're in pain. And this is, they were equating it with a pain injection. So it's almost like the whole OxyContin playbook where, and if that doesn't work, then just give it a little bit more, increase the dose
Yeah.
kind of thing.
I
So
know dogs that have
some
had it
dogs,
since they've been a puppy. Well, not a puppy, but like, like since they've been really
yeah,
young. Yeah.
yeah,
Yeah. Really, like just
yeah.
over a year
I mean,
old and stuff,
that's
and they've had it for years. Yeah.
it's horrible, I
It,
mean, it's eventually, I started getting all the cases coming to me that were pretty severe cases. And I put together a protocol. It's on a website. These 2 women who lost their dogs early on from it contacted me, and they were like wizards at putting together this website. I had to go out of town, and I wasn't sure I was going to have time to put into it. And they said, oh, just contact us when we get back. I was gone for like a week. I came back. They had a website up and running. And they're like, we just need to record you on the protocol.
yeah.
So I have a whole protocol on there up there for
Wow.
people. I was actually looking on some of the Facebook sites, and it's been helping some people, which at least makes me happy because I've seen cases that I just at this point in time, if they react strongly to it, it's like there's no reversing it. There's no reversing the.
So
There's some people that get it early.
is your protocol to like help just kind of like wean them off, or to kind of sort of like detox them from it, or kind of thing? Is that what it's for?
Well, it's not about weaning them off, and it's not about detoxing, because the way it works, it doesn't work like a regular pharmaceutical drug where it gets broken down in the liver and it has a half-life and all of this. It doesn't work like that.
Yeah.
When an antibody is a
Okay.
protein, normally antibodies are made by our our immune cells, our immune system, to float around in the bloodstream, and
Yeah.
they latch onto something and bind to something. This one was engineered to bind to nerve growth factor. So you have one protein molecule binding, man-made,
Yeah.
which the body doesn't recognize because it's man-made. It's a foreign protein binding to nerve growth factor, making a larger immune protein complex. Okay. So when you
Okay.
have these
Yeah.
large immune, this is advanced immunology, which they obviously don't teach in vet school anymore. So when you have large protein immune complexes floating around in your bloodstream, they get lodged places. They get lodged in
Right.
small little capillaries, number one.
Okay.
Some of the
Yeah.
smallest little capillaries in the body that the body really, really needs to survive and live are in the kidney. They're called the glomeruli. If these immune complexes lodge in those glomeruli, number one, they shut down kidney function. Number two, they can cause an immune mediated reaction. Okay, so if they shut down the glomeruli and they clog up the drains of the glomeruli, they get in those capillaries and they clog it up, the kidneys shut down. One of the side effects that we're seeing from these dogs are increased thirst, increased drinking, kidney incontinence, and kidney failure. Okay, the second thing, when you have these big immune complexes floating around in your bloodstream, they can create a reaction by the immune system because our immune systems are engineered to respond to proteins. Okay, spike protein on the COVID virus, you know?
Yeah. 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 I was just thinking that.
So there's, so yeah, so spike protein for COVID virus is a perfect example. So
Uh-huh.
on the outside of cells, on the outside of bacterial cells, on the outside of viral cells, there's different proteins. And our immune system will go along and say, oh, that's an invader, that's a foreign protein. So they'll
Uh-huh.
take that information, a white blood cell will take that information back to the lymph node and tell the lymph node, hey, we found this foreign protein in there. The lymph node's like, let's form an antibody to it. And the antibody will go bind it, make it inactive, and then a macrophage will come along and destroy it and eat it up and get it out of the body. So here we've got a foreign protein latched onto a protein molecule that is from the body. So it's one big giant foreign protein. And if the body happens to make antibodies to this, it's called an immunogenetic response, which they coined when they started making monoclonal antibodies. I had never heard of
Okay.
immunogenicity until these monoclonal antibodies started coming out. So that's another new term that they're using with this stuff. One place where they're using a lot of these monoclonal antibodies is in cancer therapy because the cancer cells will have a protein molecule on their surface,
Yeah.
and then they can engineer the monoclonal antibody to react against that protein molecule and destroy the cancer cell. That's the concept behind it.
Okay.
But if we have autoantibodies forming, then you end up with an autoimmune reaction. And
Uh-huh.
you've got all these big molecules around there, and if you can be a bad enough immune reaction that it will set the body into an autoimmune condition leading up to cancer. So that's one route it could take. It could also set the body up to where if there's an overload of reactions, it will activate what's called the complement system of the immune system. And if that gets activated, it's like the bells and whistles and sirens going off and the whoa, whoa, whoa. It's like the nuclear plant that developed a leak. Everybody's called in, and actually the macrophages, wherever they find these foreign proteins, they start punching holes in organs and stuff wherever they find them, killing
Ah.
cells and blasting things apart. Bleeding starts
Okay.
happening, the platelets and all and the complements used up from the bleeding, and the dog can literally bleed out and have what's called a disseminated intravascular coagulation, which means death is coming and the dog bleeds out and dies. This happens in people too.
So
So a
is
lot
this
of
sort of
people
like
that were
a
taking.
oh, go on. I was going to say,
No, go
is that
ahead.
sort of like a self-destruct mode in order to kind of like, is it sort of like a
Hmm.
protect the species kind of reaction? So rather than trying to save the host, it's kind of like
It's
shut down kind of thing. Or is that a bit too far-fetched? You know what I mean?
It looks like that when that happens, and honestly,
Yeah,
maybe that I never thought about it like that. I actually, part of myself did, but it's where the immune system, this cycle kicks in, and it's like dominoes just falling, and it just accelerates and
yeah,
accelerates and accelerates and accelerates. You can, if you're in a hospital, they'll pump people full of heparin and platelets and complement factor and all of these things to try to get it to slow down and stop.
yeah,
But it's like it is kind of, in the end, I mean, I've seen animals die that way, and it's really brutal. There have been
yeah.
cases of it happening with dogs bleeding out in front of, in people's living rooms and things like that. It's pretty serious. I've also
It's
seen quite
horrific.
a lot of cancer flaring up. Yeah. So dogs that didn't have cancer, all of a sudden, boom, 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 we've got tumors popping out and things like that. So even, people say, but my dog's doing so good on it, but you never know when that one shot is going to be given and something like this may be activated and happen.
Yeah, yeah.
It
Or
could
one of
happen
the
in the very first
molecules
shot.
is
It could happen in the third shot. Yeah,
yeah.
it kind of depends upon the individual's immune system and how they're handling it. And, yeah. The other thing
Well,
it
I
does
had
is
go
Librella,
on.
it will go ahead. Yeah. No, I was just gonna say it'll unmask. We have a delay. It'll unmask underlying nervous system deficiencies, like nervous system disease that the body's handling and maintaining itself. But then all of a sudden, by taking away that nerve growth factor, all of a sudden the dog will have like symptoms of intervertebral disc disease or degenerative myelopathy. We've had sudden blindness. We've had sudden hearing loss. We've had sudden cognitive decline. We've had sudden seizure syndromes pop up. Like all of a sudden the dog's normal one day and then the next day they're not. So, it's convenient for the drug company because it thinks, oh, these are older dogs. They would have gotten that anyways. That's their answer.
Yeah, yeah. It's one of those situations where now, well, I mean, there's loads of people that don't even realize this is happening because again, like they will probably think themselves that it is to do with something else and not the shot. Because I mean, none of these risks are going to be explained to the people during the vet visits or even when they're given the medicine to start with. Because the amount of people that I speak to about, because we do a lot of work with the gut microbiome when it comes to the diet and stuff.
Hmm.
And like, even dogs when they're on fluoxetine and stuff like that, and I'm like, "Well, have you read the insert for it?"
Oh,
And they're like,
it's horrible.
"No." And I'm like, "You need to read the insert for it." And, why, when you're ever gonna be recommended a medication from your vet, there's about a million questions you need to be asking before you even give it,
Yeah.
just to make sure you're
Yeah.
making an
Yeah.
informed decision. And the amount of people that I speak to about Librella and I try and kind of just give them this information about these side effects, and they're just kind of like, well, my vet says
Mhm.
it's completely fine, and they're just blissfully ignorant of any of this that's happening. It's just like,
Blissfully ignorant. I mean, I passed that train station a long time ago. I wish I could go back sometimes.
I
It
know it'd
was
be
just
so much
way,
more
way back
easy.
there. I it would be, just float along. Everything's fine
Yeah,
until it's
absolutely.
not.
Yeah, I know.
Until
And
it's not.
everybody's
Yeah.
kind of got that thing where they think it's never going to be them until it is, you know? But I also had an interesting conversation. In fact, no, it wasn't a conversation. It was at the expo last year. Dr. Carol Hughes from Biome for Pets did a talk about the macrophages in
Oh, I
dogs'
love her. Yeah. Oh,
microbiomes.
I love her.
Yeah, she's another big brain that I'd like to pick. So she did a talk at the
Yeah.
expo
I follow her on.
on socials.
Go ahead.
It's this lag,
Yeah.
isn't it? She did talk at the expo about the macrophages, and,
It's the
and it
leg.
basically explained that they're not behaving in the way that they normally would. So usually the macrophage is sort of like on the immune system side, and they'll come in and they'll sort of like attack what's causing the problem. But now she's seeing more and more that they're actually taking sides with the problem and kind of shape shifting into what's causing the issue, which is like super, super unnerving because we don't want that to be happening
Is that in
at all.
terms of what?
In terms of
Is
with
that
the
in terms of gut issues, or is that in
Well, the talk was on the microbiome, so I'm assuming it is related to the gut microbiome, but if it's
okay.
happening in the gut, then there is no reason why it can't be happening in the immune system
And
either.
see
Well, the
what
immune system is in the gut,
I would
so
really
I don't know.
I would like to talk to her. I need to connect with her somehow because yeah, the macrophages they do this switch thing. That's what I was talking about with disseminated intravascular coagulation. They end up they go crazy. They go after these certain proteins and they'll just gobble up and cause lysis of cells. They call this causes cells to explode and things like that. And that may be what she's seeing, but these gut problems that our animals and us, we are exposed to so many foreign proteins, we are exposed to so many chemicals and toxins and foreign chemical substrates in our body, in our guts. And any one of those can set off the immune system. So where you get autoimmune conditions. I mean, I've had autoimmune conditions happen. A lot of times we never find the trigger, but the body will just start destroying the red blood cells or destroying the platelets. Vaccines can cause that, pesticides can cause that, all kinds of different things can cause that.
Yeah.
Scary.
It is scary. It is scary because I feel like at
So
the minute as well, there's like seeing a healthy dog is a rarity. And I mean, I know it is going to be different for people who are helping dogs that have got problems anyway, because obviously you're going to see more dogs that have got problems because that's what you're doing. But it just feels like the amount of dogs that have now got chronic disease or even just itching themselves chronic and just something that is just chipping away at them is just absolutely heartbreaking because it just feels like we're going so far in the wrong direction, which, is
we've
just
I've got 2-year olds. I have 2-year-old dogs coming to me they can't digest anything. They can't eat anything because everything is causing them to vomit and liquid diarrhea. I've never seen this before in my life. I just put something out to a private group. I'm like, I am seeing more cases of protein losing enteropathy diagnosed and protein losing nephropathy diagnosed of the kidneys than I saw in this past year than I saw my whole entire 25-year
yeah,
career. Like, what is going on with this? And it's like the hemorrhagic gastroenteritis. We think we trace that back to a toxin that's in the kibble. But, this whole globalization thing that happened in the 90s and when they started with glyphosate, you might have, essentially now almost all the brands are all bought up and they're all getting their ingredient sources from the same location. So if
yeah,
there's a problem in one, there's like a problem in all of them. And
uh-huh,
people have to understand this. It's so crazy. So I can't even I tell people, they're like, well, what about a kibble you can recommend? I said I can't conscientiously recommend a kibble to you right now.
yeah. I say that, to
There's
be
not a
honest, I
single
do.
kibble that I would let enter. I'm like, there's not a single kibble out there that I would feed to my dog or my 20-year-old cat. I have a 20-year-old cat who she's not on any medications. She's never been on any pharmaceuticals. Didn't give her any vaccines myself. She may have had a couple before I got her. I found her on the streets, but she's eating
Yeah,
farm to table food with fermented food with raw goat's milk and bone broth, and she's doing good. I mean, she's getting weak and she has some issues and stuff, but she's 20 years old.
yeah,
But I just lost my dog 2 months ago, a 15-year-old shepherd husky who came to me with horrendous arthritis, like horrendous. But he just unplugged my computer. I gave her, she was on Chinese herbs, on really good food. And when it came time, she just, her hind ends got weak and collapsed. And then I was like, she gave me the signal it was time. She
yeah,
wasn't on any drugs or anything, you know? And
yeah.
why not? They
And
can
I
live
think
out their lives eating good food and.
yeah, yeah.
Go ahead.
So so this brings me to my question, which brings us back to Librella. Oh, I mean, do you know, it's so annoying. I have this thing I say "so" a lot. It's so annoying. When you have a dog, when you have a dog that obviously is in pain from arthritis or, some other reason, a limp of a
Mhm.
2-year-old puppy, let's say, for reference sake,
Mhm.
would be your recommendation then to deal with that pain? So obviously it's not going to be Librella. So would you then
What I
turn to the NSAIDs or would you
what
kind
I
of like, yeah,
There are so many ways, and that's what I give on the website, Pet Advocare. I mean, I made a list of 20 different ways to treat arthritis, and
wow,
number
yeah,
1, arthritis is inflammation in the body.
inflammation,
So you put
yeah,
them on an anti-inflammatory diet.
yeah.
That takes care of a lot. You get them off the seed oils. I don't know if you guys over there are dealing with seed oils or not, but
A few of us
any of the
are.
seed oils, the hydrogenated oils.
A few of us.
You get them exercising, exercise, move the joints, physical rehab, just walking around the block, something, get them moving. Then there's so many different things out there. Bone broth, undenatured collagen type 2, a fancy name for the collagen that's in chicken bone broth. They did a study comparing it with on force plate analysis for pain and found it worked better than a nonsteroidal anti-inflammatory, taking inflammation out. So
Wow,
not
that's
only does
amazing.
bone broth heal the guts, it heals the joints. So it probably is helping the microbiome in the joints as well, because there's microbiome not just in our guts, but in our joints. And that's a
Yeah,
big issue as well. There are so many things. There are so many herbal formulas. There's turmeric. There's just anti-inflammatory herbs, boswellia formulas. There's green lip mussel, glucosamine chondroitin, which people are moving away from. I still think chondroitin has a place in it. I'm using a lot of powdered collagen right now in my practice because people can mix it in the food. It doesn't taste bad. They're going to get collagen to help rebuild those joints and the soft tissues. Acupuncture, red light therapy, laser therapy. Learn to massage your dog. We all love to pet our dogs. Take a basic massage class for your dog. It's not difficult. You don't have to know every muscle and insertion and everything else. I teach my clients just simple massage technique. Moxibustion, light a stick of moxa, and you can treat the acupuncture points on your dogs. You can make your own herbal medicine or put herbs in your dog's food that's going to help arthritis. There is
yeah,
so much that can be done before, and I would never do Librella, not even if my dog was, I could have given it to Molly. She's my heart dog. I could have given her a dose of Librella. There's no way I would have injected that dog with Librella. There is
yeah,
absolutely no way. For
yeah.
what I have seen it do to patients, it would. I had a lab who died from it, and it just broke my heart
Oh,
because the owner of the dog, he loved that dog. It was like his baby girl, and the vets they killed that dog. I'll flat out say it. They killed that dog. And she ended up breaking with enlarged lymph nodes, which could have been an immune reaction, but it turned out she had been tested positive for Lyme. So I don't know if the Labrella reactivated the Lyme disease in her. They didn't get a definitive diagnosis, but all the vets were jumping, oh, it must be lymphoma. So they started the dog on chemotherapy without a definitive diagnosis, a board certified
what?
oncologist, and killed her with chemotherapy. The whole case was an absolute disaster from start to finish, and I am at the point now where I get on the phone I got on the phone with the oncologist and just grilled her. The dog was already dead, but I was like, "Well, what about the results of this ultrasound, and how come you didn't find this and this, and where were why didn't you stage the lymphoma, and what protocol were you using? Were you just randomly grabbing chemo drugs and giving to the dog?" I mean, I grilled her like 45 minutes and I said, I want to see the records. But I just wanted her to know the places where she had taken wrong turns and
Yeah,
wasn't thinking through the case.
yeah.
And I made it very apparent to her on the phone.
So this brings us back to the issue we were talking about earlier, that vets are now kind of lacking the ability or even just the maybe not ability, but even just the willingness to use critical thinking and look at cases from like stepping back and assessing all of the notes and looking at the dog as an individual and looking at the different applications and stuff.
I think they're not
You know
being
what
taught how to. When I was in
Right, okay.
When I was in vet school, there's a method that they taught us, and they taught this to doctors too, called SOAP, which stands for subjective, objective, assessment, and then plan. And we would learn to work through cases using this. So the subjective would be you talk to the client, you talk to the caretaker of the animal, and how they've been doing, coughing, diarrhea, vomiting, what's going on, how's their appetite. So that's subjective, all that history. And then you do objective, so you take pulse, temperature, respiration, lab results, what is your physical exam findings. You put your hand on the dog and actually check all the symptoms. You listen to the heart, you listen to the lungs, you watch them walk. Then assessment is where you form what's called differential diagnoses. You take all the different possibilities for each symptom that you find or sign, you take all the different possibilities that could be causing that. And we would use, it was called the DAMIT scheme. It was like degenerative, endocrine, immune mediated, neoplastic, trauma. We had all these categories, and you would come up with different diseases within those categories that could be causing this sign. And you would, like, at first you would literally write all these down. So you'd have all these lists, and then assessment would be like, how do we narrow this down and find out if it's cancer versus an endocrine problem? So let's run our blood panels, or let's do x-rays or something like that. So that's how we would approach cases. Now, the way they're approaching cases is through the algorithm. The good old algorithm. It's going to bring down civilization, I think. So you start out and say, is
Yeah.
there vomiting and diarrhea? Yes or no? Yes. Is the vomiting yellow? Yes or no? No. Is the vomiting, and you go down the algorithm. But the problem is every step of that algorithm, it shuts out all these different possibilities. And so it can
Yeah.
lead vets into these really weird, what we call zebra diagnoses. It must be this because I went through the algorithm and that's what it said. Like, I had a friend of mine who's a vet. They have an emergency clinic attached to their clinic, and one of the technicians came running to get her because they were going to discharge a dachshund, thinking it was stomach upset in the dachshund, and the technician recognized what was going on. She went and grabbed my friend and said, "You have to come look at this dog." And my friend walked in and she's like, "Wow, it looks like the dog's in back pain and probably has a herniated disc." And yet the dog was hunched up, but they were right out of school. They could not recognize the posture of a dachshund with a herniated disc. They were going to send the dog home with anti-vomiting, nausea medication. So this is what we get when we deal with algorithms, as
Wow.
opposed to broadening our thinking and doing something like this. The SOAP protocol has been used for decades and decades and decades in medicine to reason through cases. And that's really what they need to go back to.
Yeah, and I bet the reason why they don't do it
It's
now, obviously, is because all the clinics have been corporatized and now they haven't got time to do that because they need to get as many people in and out as they possibly can. And they've got things that they want to obviously prescribe
sell,
because they're
sell.
owned by the companies that make the drugs. Yeah. Well, yeah, sell. Yeah,
Yeah.
basically. It's such a sad, sad situation. Yeah. Ugh. Okay. So coming back to Librella, it was actually approved in the UK before the USA, wasn't it? By about 3 years.
Yeah, it was.
And I did a bit of research, and the last update from the Veterinary Medicines Directorate was on the 15th of January this year, and there is no mention of rapidly progressive osteoarthritis anywhere, and it still just lists that the adverse reactions are like diarrhea, vomiting, some problems with coordination and balance, incontinence, anorexia, and lethargy, and then obviously the injection site reactions, hypersensitivity reaction, immune mediated hemolytic anemia, and immune mediated,
Mm,
is it thrombocytopenia? And
thrombo.
that's what's listed as the
Yes.
adverse reactions.
Now it's interesting that those last two, the autoimmune hemolytic anemia and immune-mediated thrombocytopenia, those are both autoimmune conditions. triggered by that immunogenicity that I was talking about. So that's interesting that they even included those
Yeah.
on there, which they means, everybody is so bought and sold off and money running the world right now, but it means the fact they had to list those, that they've seen a lot of cases, that they can't ignore it,
A lot of cases, yeah. Yeah. Well, I
you
mean, I
know?
also did a quick Google search as well because I thought most pet parents who are going to be taught to about this injection are going to use Google or ChatGPT to get information about it because that is what everybody is using right now to find answers to their questions. So Google says that there are less
That can
than, where is it? I know. Um, there's Google says there's less than 0.2% of dogs experiencing these adverse reactions from this medication. So this is what we're up against as well. So like obviously all the things that you have seen and you have I mean, like it's traumatic for anybody having to see these things, never mind the guardian of the dog. So there's like, just these little circles of people trying to advocate on the internet and shout as loudly as they can, and yet still
yeah.
not being heard because Google and now ChatGPT, annoyingly, is kind of running the show, and that's where people are getting all the information from.
There's a splitting of the worlds happening, and there's those people that are either know not to believe everything they see from ChatGPT and Google and know where to get good information, and there's those people that don't.
Yeah,
And at this
yeah.
point in time, I have had numerous scary things come out of ChatGPT. I have a Doberman I'm working with right now. That dog's entire microbiome was wiped out because of 8 weeks of antibiotics at double the dose because of ChatGPT. Because the owner looked up ChatGPT and took it
What?
into the conventional clinic, and the conventional doctor was a pleasing, "Oh, we'll do anything to please you and keep you as a client. So yeah, we'll do what ChatGPT says." They had a dog that slated
What?
with a cruciate tear, went on double the dose of enrofloxacin for kennel cough. Well, was on a full month of doxycycline. That didn't work, but it was kennel cough. I told him the dog's going to cough for 10 weeks no matter what you do. Then went on enrofloxacin, then went on double the dose of enrofloxacin. And enrofloxacin can damage ligaments and collagen and the whole thing. And now the dog's got liquid diarrhea. And this is because ChatGPT knows everything. If when it first started, I was like, people are like, "Oh, let me tell you what ChatGPT has to say." I tell them right away, right away. I was like, "I don't want to hear it. I don't care what ChatGPT has to say. I don't want you to read it out loud to me. It is not on my devices. I will not log into it. I will have nothing to do with it, period." Now, if you want to use ChatGPT as your doctor, if you want to use ChatGPT as your physical psychotherapist, as your boyfriend, as your confidant, whatever, fine, go do that over there. I don't want to hear about it, and I will not be your veterinarian.
Yeah,
That's
it
where I
is.
am with it.
It's
It is
yeah.
very scary,
It is, and it's
you know?
again, it's one of these things that are removing, like people are going to think even less now because they
Yes.
think that they can
Yeah.
just use that to
Yeah.
think for them. So people, and obviously we know the
Yeah.
less you use something, the less you can use it. So this is going to be, I think, like you say, I mean, this is a completely different topic now, which probably you could talk about for a whole day. But this is the problem we've got because this is what we're up against, and we're just kind
Yeah.
of like, I mean, I
Yes.
know the holistic community is growing, and the more and more people are starting to kind of become aware of alternative things and are searching for answers because they've been failed by the system so many
Mhm.
times. But it is still like every time you feel like you're moving a small mountain in the space you've been working at for so long, then there comes like another bigger one that you've got to kind of get round, which is, what we're up
Yeah.
against at the moment.
And that's
But we'll
and
keep
that's
battling
why, I
on.
mean, yeah, we'll keep battling on. And I mean, people sometimes get upset with me. I remember when I first came out, it's going to be 2 years this December, 2 years. I've been yelling about the Librella thing, but I put something up in red letters on Facebook saying, "Do not give your dog Librella," just as a warning. And I had people in the holistic community, well-known people, poo-pooing me. Well, isn't that a little bit of strong or opinionated? And I said, it's not opinionated. It might save your dog's life. The person who responded to me like
Yeah.
that, who is well known in the United States in the holistic community. His dog, he had already given it to his dog. His dog died 4 months later because of complications from the Librella. Now, so I'm the type of person, there are certain things that I will take a stand on. ChatGPT is one, Librella is another one, and a lot of these other drugs, trazodone. Oh my God, don't get me started on some of this. But there's got to be a line drawn of what we will say is okay and say is not okay. I had to push my
Yeah.
way onto some of the biggest holistic podcasts because everybody was afraid to take on this topic, Kat. I mean, I thank you very,
Yeah.
very much for
Yeah.
having me come on here just to talk about this. The biggest names,
Yeah.
you know who they are. Two of the biggest names still refuse to have me on to talk about Librella. And their marketing gatekeeper worked her way and did this whole fancy dance so that I couldn't get on there to talk about what we talked about today. So
Yeah. Yeah.
I don't know what it is. I don't know if they're afraid of losing followers. I don't know if they've been bought off, if they're receiving money from Zuckerberg. I don't know. And I don't really care. I just want to get the word out. And so that not one more dog gets that injection in them. I got to the
Yeah.
point I had to
Yeah.
step away because it's so heart-wrenching. I have this gorgeous black German Shepherd I treat. I just saw him a few days ago. We got him leveled off. It looked like he was walking like he had severe degenerative myelopathy, like after like 3 days after one of those shots. He got 4 shots total. We've got him leveled off. His back is looking better. He still goes out for his mile walk every day. He's eating good, and hopefully he can live out his life in relative comfort. But it's really sad, you know,
Yeah. It
when you
is.
can't
It is.
do
It is. It's sad.
it. Give me a dog on I'll take a dog on NSAIDs with the liver problems. I'll take a dog on prednisone. I'll take a dog on phenobarbital any day. I'll take a dog on any of those meds because I know how to help the body deal with the medication, how to get them on lower
Yeah.
doses, how to help them heal from it and everything else. But this injection, particularly these monoclonal antibodies, once they trigger that immune system, it's over with. You cannot reverse it.
Yeah.
So that's why I tell
Yeah.
people it's like playing Russian roulette. Which injection is going to have the bullet in it that's going to kill your dog?
Yeah. So
And
so
I'm
it's
not
not a
afraid
case
to
of
say
thinking,
that.
your dog get yeah. It's not like your dog gets one shot and they're okay with it, and that means they're gonna be okay with it for the rest of the life because it's not just like a
No.
it's not that kind of risk. It's a continued risk every single time they have the shot.
Yep. With probably increased risk
Yeah.
every time they have the shot.
Yeah. Yeah. It's just I mean, it's one of those things where I just don't. I mean, it might just be me. I mean, I've got one of those brains where I like to ask all the questions first, and I like to
Mhm.
kind of just sit and think about it and think, well, yeah, I see. I mean, I'm a nightmare at making decisions. Ask anyone that knows me. I can't make a decision to save my life. And it's because I
Mhm.
try to think about things too much. But I can't understand why anybody would just kind of just say, yeah, okay, let's do it without even asking or even pondering about how it
I
works and how it impacts other areas of the body and how it gets filtered out and
Well, there's something with human beings. I mean, rack my brain. One of the biggest things is why are vets falling for it? Why aren't vets thinking about it? And do not know
yeah,
it's not
yeah,
like they're making a bunch of extra money. And it's also like people run off their emotions. There's an incident happening today online actually with a quote unquote holistic coach that has kind of boondoggled a whole bunch of people. Like she doesn't really know what she's been talking about and has caused a lot of issues and problems out there. And it's all just coming out right now. But the reason she got hooked people in to pay a lot of money for her programs and her consulting was because she played on their emotions. And it's just that's what ChatGPT does too. It reaches in and plays on that soft spot. Well, maybe this is the miracle thing that's gonna give me another year with my dog. And I
yeah,
think that's really evil. I think it's actually very evil to give people false hope and then to take their money from them and not really help and possibly harm their dog instead of help. That's my definition of evil in the world right
yeah,
now, and there's a lot of it, you know? And I'm not gonna give anybody false hope. Like, I'll tell people I'm a Buddhist at heart, and I think every single day we have on this earth is a gift given to us, and we none of us know how long
Yeah.
we're gonna live, so we need to live the best we can every
No.
single day, and
Especially now.
do what we can for our animals. Yeah, and like what you're doing, like homeschooling your kids and homesteading and eating good food and getting back to the land, sitting under trees,
Yeah.
growing herbs and vegetables, and that's what humans were meant to do on this planet and not have this false hope
Yeah.
and walk around like drugged out zombies.
Yeah. I'm laughing
Yeah.
because it's true, and it's kinda like one of those nervous laughs because, like, if you don't laugh about it, what are you gonna do?
That's my line. That's my line all the time because if you don't laugh about it, you're gonna end up crawling into a hole somewhere and never coming out again. But yeah, we need to have the
Yeah. I
conversation.
know. I know.
We need to keep having the conversation and getting the conversations out there
Yeah.
so that people, see a different way of doing things. And there's people are coming around. I have a stand, it's called the Southwest Ranches Farmers Market down the street from me, and they sell farm fresh eggs, they sell all the raw milk products and raw cheese and pasture raised meats and everything. They started out as this little tiny place. Now that was only open on weekends. Now you can't even get in their parking lot. They have got people, and it's
Yeah.
expensive food, but people are willing to pay more to get good, healthy food that isn't going to
Yeah.
make them sick. So
Yeah. Yeah.
it's
Well, we do. I
slowly
drive.
happening.
It is slowly happening. I drive about an hour to go and pick up my pasture raised beef and pork because there's no local farmers closer than that. And we
Yeah.
drive. I think it's around about half an hour to 40 minutes to go and get raw milk as well. Like, because there's no, I don't have a milk cow yet.
Right. And then, the milk has a lot of work. Talk about work. Oh my goodness. Yeah. Yeah. But
No, yeah, I
yeah.
know. But no, I do agree. I think we do need to keep having these conversations, and they don't have to be sort of like social media is a really bad place for making things incredibly toxic, and they don't
Yeah.
have to be that way. Like we can have conversations as people and talk about things that maybe we disagree about and stuff, and do it, in a nice kind of way.
You know,
But the fact is
where
that we
more
do
of that
need to
is happening,
have these conversations.
Substack is where more of those it's more conversational. And you can actually people will make for
Oh,
whatever
is it?
reason, it's not so it is, you should check it out. I have a Substack. You can read my Substack app. All my Librella stuff is on there because they don't censor. So I'm not gonna get I was getting shadow banned like crazy. I can't even tell you how shadow banned I was getting off of Facebook and Instagram. So I went over to Substack to get this information out. But people will make comments and we can actually have discussions back and forth on there.
Yeah, yeah, yeah. Rather than just hatred.
It's right. Like, yeah. Yeah.
Yeah, I know. I get it. I get it. I get it. I'm gonna check it out. A few people have mentioned it to me now. I've just not had time to kind of like dive into another platform. You know what it's like.
Yeah.
But yeah.
Yeah.
Okay. Well,
Just go check out my stuff on there. You have an excuse
I
to
will.
check out my
I will.
Substack
Yeah, I
stuff.
will. I will. Thank you. Well, I think. Is there anything else we've forgotten to talk about in regards to Librella? Is there anything we've missed?
No, I mean, just the
No, I
final
think we've
thing is
covered it.
I would never give it. Yeah. I would never use it. I couldn't conscientiously inject it into an animal. Let me put it that way. Yeah.
So what I'm going to do as well is I'm going to, in the show notes, like I do as always, I'm going to put links to your website, links to your socials, and I'll put a link to your Substack. And what I might even do is find the Librella stuff on your Substack and put a link to that as well. So if anyone listening wants
Okay.
to check out
Yeah.
all of the extensive work that you have done, they can absolutely do that, just by following the show notes as
And
well. And that should make it more accessible for people to read.
And also put a link to www.petadvocare.com.
Advocare.com. Okay. Yeah.
That's the now, if people want the real data on Librella, there's a data scientist who's compiling worldwide data on the front page. It has my protocols, so to help people get through it, if you know, and now, I mean, I it was like a miracle the other day. I was like, they were like, "We followed the protocol and our dog is getting better," which, I mean, it makes me happy. Not all of them get better. I've seen so few of them improve and get better. So just if even one
Yeah.
does, it makes me happy, you know? Yeah.
Yeah,
So,
absolutely. Well, thank you. Thank you for your generous input into this as well. You can tell you're wholly passionate about it as well, and that it does mean a lot to you. So, thank you on behalf of the
yeah.
people who are going to benefit from all of that information.
Yeah, you're welcome. Thanks for
Um,
having me on here, Kat.
yeah, thank you.
Yeah,
Yeah, thank you for coming. Like I say, it's been a pleasure to talk to you at last. And I mean, as you can tell from the previous conversation, there could have been a million other topics we could have dived right into.
yeah,
Maybe for another time. But
yeah,
yeah, thanks
exactly.
again, Josie, and I'm sure we will catch up again soon on another episode.
Definitely. Take care.
Mm.
Bye.
Okay.
Thanks for listening to another great episode of the My Dog Made Me Do It Naturally podcast. Don't forget to check out the caption for any links discussed here today. And please, if you enjoyed the show, follow along and listen for free on your favourite podcast app. If you have any questions or would like to share your story, feel free to email me at mydogmademedoitnaturally@gmail.com. Thanks for listening. Purpose of this podcast is for educational and entertainment purposes only and should not be substituted as advice from a veterinarian or other professional. It does not form a client relationship with me, the host, or any guest speakers, and any information is not intended to and does not diagnose, treat, cure, or prevent disease. And my guests express our own views, thoughts, and opinions as individuals, and the podcast neither endorses or opposes the views, products, or services discussed here. If your pet is ill, always seek advice from your veterinarian. I am not a veterinarian and I do not treat disease or offer medical advice.